is a Brighton Case Definition? A Brighton Case Definition has been created by a working group of the Brighton Collaboration. It adheres to a standard process and format designed to facilitate a harmonized global approach to defining adverse events. Stated simply, it is a definition that is intended to enable everyone concerned with vaccine safety to discuss the same topic. This includes vaccine regulators and manufacturers, vaccine safety researchers, public health professionals who oversee vaccine programs, and healthcare providers who give immunizations or who see individuals who may have had an adverse reaction to a vaccine. What does a Brighton Case Definition look like? Each Brighton Case Definition consists of selected criteria representative of the event being defined. Criteria may include clinical signs and symptoms, diagnostic investigations, the illness time course, and specific exclusionary criteria items. For most Brighton Case Definitions, the criteria are arranged into 3 tiered levels, 1, 2, and 3. These levels reflect the diagnostic certainty with which an event can be defined. Sometimes, with simple events such as fever, only a single level of diagnostic certainty is included in the definition. Other times, there may be only 2, as is the case with aseptic meningitis and thrombocytopenia. However, the vast majority have 3 levels. The levels have nothing to do with disease severity, and with rare exceptions, the levels also have nothing to do with causality, that is, whether or not the vaccine caused the event. Level 1 is considered to define the highest degree of diagnostic certainty. It provides the most specific definition and as such may not be achievable in all settings. Often, but not always, it is considered to equal a definite case. Level 2 is a bit less specific than level 1 in terms of diagnostic certainty and might be considered a probable case as opposed to a definitive one. Level 3 is the least specific, but also the most sensitive. It is the level that can most often be achieved in low resource settings. Often only clinical criteria are included. If laboratory tests are required, they are generally available in all settings. This is the lowest level of diagnostic certainty, reflecting only a possible case. For some case definitions, 1 or 2 selected criteria may be considered essential for all levels of certainty. They will be identified as such ahead of defining what is unique to each level of certainty. As an example, consider anaphylaxis. There is an absolute requirement that there be symptoms or signs from 2 or more body systems, such as skin rash and difficulty breathing, and both must onset within an hour of each other. If this can't be established, no level of diagnostic certainty for the case definition can be met. Because not all cases will meet the case definition, there are 2 additional classification levels. Level 4 is applied to cases that are reported as a given event, but lack sufficient information to meet any case definition level of diagnostic certainty. Level 4 indicates diagnostic uncertainty. It is important to see this level as one that may be temporary. Follow-up to gather more information may result in the case meeting a higher level of diagnostic certainty. Level 5 is applied to cases where there is sufficient information present to determine that the reported illness is not a case. There are 2 ways to reach this level. First, when it is known that a criterion required to meet any level of certainty was not present. As an example, let's consider a reported case of anaphylaxis, where it was clearly stated that the only systems involved were skin and respiratory. But the time course from the first onset, involving skin rash only, to progression to shortness of breath and wheezing took several hours. The second way to reach level 5 is when it is known that an exclusionary criterion was met. As an example, let's consider an alternate diagnosis such as pulmonary embolus, to an explain an illness that was first reported as pericarditis. Are there situations that are not covered by Brighton Case Definitions? Yes. Brighton Case Definitions are not intended to guide patient treatment. It is not uncommon to have case definitions developed by medical specialty societies or other organizations that are specifically intended to guide the management and follow-up of patients with a given event. When developing a Brighton Case Definition, one of the first tasks is to search for existing case definitions and determine whether or not they support vaccine safety assessment. Sometimes existing case definitions are incorporated into the Brighton definition. This was true for the acute respiratory distress syndrome, or ARDS, which followed accepted existing separate case definitions for adults and for children, with some adaptation to fit the Brighton format. How is a Brighton case definition unique? Brighton case definitions are specifically designed to support vaccine safety studies across the entire lifespan of a vaccine, from initial development to use in large populations. They provide a framework that supports finding, identifying, and classifying events of relevance to vaccine safety. The first Brighton case definition was for fever. This is a common reaction occurring in 1% or more of vaccinees. Prior to creating the case definition, a study was done looking at over 120 vaccine studies that included fever as an outcome following vaccination. Study investigators used 9 different cutoff temperatures to define fever, making it impossible to compare the results of one study to another. Brighton case definitions are specifically designed to enable a harmonized approach to safety data collection, which can be applied in multiple settings. Here are 4 scenarios. Number 1, studies designed to assess vaccine safety. They can be used across all studies designed to assess vaccine safety. Before approving a vaccine for use, regulators require data that prove the vaccine works and that the benefits outweigh any possible risk of harm. Studies to generate such data start with only a few individuals, but then expand over several phases to involve hundreds and then thousands of people. This process often starts with healthy adults and then moves to include younger age groups and those with underlying conditions. Even after approval, vaccine studies are required to continue in the post-market phase. This is done because many vaccine safety concerns involve very rare events that may not be identified until hundreds of thousands or even millions of people have received the vaccine. Using the same case definition across all vaccine safety study phases ensures that each case that may be identified contributes in the same way to an understanding of the possible harms of the vaccine. Secondly, studies that estimate the incidence of an adverse event. Brighton Collaboration case definitions can also be applied before the start of a new vaccine program in studies that assess the incidence of an event in populations who have never been exposed to the vaccine. This provides an estimate of the number of purely coincidental events expected to occur depending on the number of immunized people over time. Third, to detect new safety concerns during program implementation. They can be applied once the immunization program gets underway to assess any new safety concerns. The term vaccine safety signal is applied when observed cases are greater than expected. All such signals require further study to determine if the increase in case number was related to the vaccine. And finally, fourth, to evaluate safety signals across studies and countries. As part of safety signal evaluation, they can be applied across multiple studies done in different countries by a variety of investigative teams. It is critical that the same case definition be applied so that reliable and valid vaccine safety evidence can not only be generated, but also combined in meta-analyses to settle the question of whether or not the vaccine caused the event. Why are Brighton case definitions trusted? A standard process is followed for the development of all case definitions. A Brighton Collaboration working group is formed with several people with clinical expertise in the event to be defined. They are joined by experts in vaccine safety and the process of developing Brighton case definitions. A thorough literature review is conducted to identify existing case definitions and the most up-to-date information on the epidemiology, clinical signs and symptoms, disease course and outcome, and diagnostic methods. The working group meets regularly to review the literature and come to a consensus on the case definition criteria following the Brighton format. The draft case definition is then posted online for review by vaccine safety stakeholders. They are asked to assess the applicability of the case definition in their settings and to determine the feasibility of meeting each level of diagnostic certainty. Subject matter experts who are not in the working group also provide reviews. They assess the scientific validity of the case definition. The working group then goes through all reviews and discusses appropriate responses, which may include revisions to the case definition or explanations for why no change will be made. The final case definition, all reviews and working group responses are then submitted to vaccine for publication.